Hi, my name is Alyssa Sadak.
And I'm Ashley Johnson. We're both occupational therapy students at University at Buffalo.
Today we're going to tell you a little bit about the career of occupational therapy. Here are a few success stories of people who received occupational therapy services.
I had a great deal of pain in my joint in my thumb and also in my fingers. Well, we talked about getting joint injections, which I received a joint injection intermittently before I had the surgery. But we knew from the x-rays, and since I also had the same symptoms and the surgery on my right hand, that I was bone on bone, and eventually it had to be taken care of if I was going to be pain-free. After I had the surgery, a plastic surgery did the surgery, and I also had my carpal tunnel taken care of at the same time, which was a bad idea because my recovery was much slower than it was when I just had the basal joint done. So yes, I was referred to an occupational therapist. Actually, I was very lucky because it's one of my departments that I oversee. The director of occupational therapy did my therapy. So I had I'm sure it was the same treatment everybody else gets, but I did feel special. Though I have to tell you, I didn't know that an occupational therapist took care of the hand. I think you think of an occupational therapist just doing ADLs, and that's not true. They do hand therapy also. So I was pleasantly surprised that with my experience with my right hand that I was going to see an occupational therapist and not a physical therapist. I did see improvement. Plus, she gave me the appropriate brace. I had 2 different braces to wear, which was really good. So yeah, step by step, I was told every step of the way, I was told what was going to benefit me, and I was very appreciative of that. I couldn't do it without the help of my OT.
Slightly, it was a little different, not being able to use that hand to do the, doing the dressing was okay, but getting dressed and everything in the morning and stuff like that, that was difficult. I was referred to an occupational therapist about 2 weeks after the injury, which was good because then I didn't know what I was dealing with because I never had an injury of this sort. The occupational therapist had me do various things. One was putting my hand in dry rice and squeezing, and that was to desensitize the nerve endings because I had a lot of nerve endings where I didn't know what my hand was feeling. Even if I would put my hand in a pocket and try to grab like a coin out, I couldn't tell what coin I was getting. And at that point, I couldn't even tell where my finger was how deep it was in the pocket. Also, other things to do was squeezing clay, different grades of clay. So you had different viscosities of clay. And then also using clothespins to actually put clothespins onto a rack and take them and put them on the rack, not using my other hand to help anything, and just doing that. That was to help. All this is to help the motion of the hand, get my mind to where the nerves are. Because one test she did was she had me close my eyes, and she had a little light, like a hair-like thing, like a cat whisker, so to speak, and she was touching my eyes closed, and I had to tell her what finger she was touching and everything. And then at one time I thought she was goofing around, and because it felt like it was touching all my hands at once. And she says, "Open your eyes," and she had held it right at the tip of my finger. My brain was messed up to the nerves. The nerves didn't know where to go. So that was very awkward, but it was, it was something that she had to explain to me what was going on. As far as seeing an occupational therapist, I think it was very important because no one is experienced in already having something done to themselves and not knowing what to expect. And who better to ask questions to is to an occupational therapist. I had a lot of questions for her, and she was interested and she was very knowledgeable in explaining everything. And it was quite an experience in itself. I mean, the injury was an experience, and going through the recovery was more of an experience. I don't think I could have gotten the results I did without having to see an occupational therapist.
My mother was diagnosed with Parkinson's disease and dementia back in 2011. She began having really bad hand tremors, which is pretty much typical with Parkinson's disease. As her hand shaking got worse, she had difficulties doing things like holding a glass, holding silverware, and even getting dressed. She was eventually admitted into a nursing home where she immediately started occupational therapy. The therapist had her working with Theraputty, making cookies, baking, and doing arts and crafts, which is how we share some of our quality time with her. Now, with the help of her occupational therapist, Mom is comfortably doing many everyday things again, getting dressed, feeding herself, and holding a cup of coffee without spilling it. We're all very happy with her hard work and advancements. She's really come a long way. She couldn't have done any of the things that she does today without the help of her OT.
Tyler was diagnosed before 2 with a sensory processing disorder, and then as soon as he turned 2, he was diagnosed with autism. The first signs when he was younger, 6 months, was not wanting clothes on. The other things would be not wanting to take a bath, and as he got a little bit older, just everything from loud noises to even television hurting his ears. And that was probably the first signs I knew something was wrong because he was so easily agitated. After Tyler progressively got worse, I went to my pediatrician and they didn't see any signs that anything was wrong. So I actually walked into a private clinic that specialized in OT, speech and physical therapy, and an OT did a evaluation and then sent it to my pediatrician showing that he needed services. Yes, without the help of an occupational therapist, I don't think Tyler would be able to function on a daily basis. I mean, he was so severe that besides getting dressed, it became even a food problem. And he wouldn't even be able to go to school, go to the store, get in the car without regulating. And we put him on a sensory diet, and I had to do it at home. So they had to teach me everything at the clinic so I could go home and do it. It's not just you take him in and you're done. I mean, the education piece was so huge so I could even get him out of the house. In understanding what exactly happens when you get dressed, and first you put on pants, then shirt. Like, we had to break it down really specifically. So those were the early things that they taught me that were very basic. But as he got older, it got more complex because his sensory needs were so great. So in school, like I said, without sensory, he would not be able to function. So, for example, when he was little and he had to sit in a circle for circle time, he'd be fidgeting and he wouldn't be able to sit still, and everybody would bother him and noises. So the OT would do joint compressions or have him sit up straight and teach him how to participate in just something as simple as sitting in a circle. They also helped, when he was younger, teach the teachers, well, if you notice he's having a hard time sitting still, here are the strategies, whether it be picture schedule or joint compressions, and also acquiring a sensory room for him, because some schools aren't equipped to even know what to do. They just look at it like bad behavior when really he's struggling with sights and sounds and colors. And then as he got older, it became more difficult because once we got out of early intervention, we didn't get as much help. So the school systems are basically on their own without as much therapy. So his therapy lessons, and pretty much it's everything that they've taught me that I have to incorporate. And then I teach the teachers because we weren't getting enough OT. So now he gets about 2 times a week for 30 minutes. But if you look at his whole entire day and the amount of sensory he needs, he still needs about every 2 hours. So right now our challenges are that who's going to give him or who's going to teach him and show him what he needs every 2 hours when he's only getting 30 minutes 2 times a week. So there's people that aren't really equipped to show him what to do in the school systems right now. So I'm just grateful that there is an OT to help everyone know what to do with Tyler, but there's just not enough. There's too many kids with needs and not enough OTs. They taught me things like, if you're gonna spin him one way, you have to spin him another, and you also have to shake him because his vestibular system is so sensitive. Tyler has a trampoline, and he can jump, but jumping isn't just gonna help him because he can stim, so he has to jump and crash, or you have to quiz him when he jumps. And I think the most important thing is when you notice Tyler, pay attention to him. Like, does he seem elevated? Does he seem under-aroused? Does he seem over-aroused? And they've given me the tools as his mom to regulate him through the day. Like I said, even getting in the car, if he's jumping and he's agitated and fidgety, then we need to do some calming. He could do push-ups, he could do heavy lifting, and if he's too tired, he needs to get on that trampoline and he has to jump. And swimming has been, I never knew that was such a good sensory. So that was one of the reasons we bought a house with a pool, but like they were telling me swimming is so good because it just gives them equal. So he needs sensory probably 2 hours every day. Tyler wouldn't be where he is today without the help from his occupational therapist. I feel very grateful.
Do you know what OT is?
Occupational therapy.
What does your OT help you do?
Like do sensory and stuff, like push it.
Yeah, do you want to show us? What did your OT help you do?
Like, helps you learn.
What are some things that your OT helps you do? Do you jump on trampolines?
You jump on trampolines. You do stuff called ABC push-ups. You and in my OT class we do a bike, an elliptical, ABC push-ups, and jumping on a trampoline. Then after we do putty. Then we do a game.
Game?
I don't know. Sometimes we don't have games because it's like there's not enough time.
Thank you for taking the time to learn a little bit about what OTs do.
You can learn more about occupational therapy at aota.org.
I couldn't do it without the help of my OT.
Her OT.
My OT.
My OT.